Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
I'm Devika, and I'm a thoracic medical oncologist at the University of Alabama at Birmingham. And I'm excited to talk about a topic that's very dear to me, is lung cancer screening. Overall, cancer screening is something that has been available for our patients for many years now, and we have information from breast cancer and cervical cancer that screening patients and diagnosing them with some of these cancers early or with precancerous lesions can save lives and potentially lead to cures for patients who would be diagnosed with these diseases. We are in the middle of a global pandemic, hopefully towards the tail end of that. But as with everything else in healthcare, we have seen some repercussions of the healthcare disruption that has happened with COVID. And so what has happened to cancer screening? What are we seeing as physicians with patients who are eligible for cancer screening in the past 2 years? So there was some data that was presented in one of the medical journals that showed that due to the COVID-19 pandemic, the breast cancer and cervical cancer screening rates have gone down. Similarly, there have been some changes with colorectal cancer screening and all the tests associated with that. What that means for patients is that when there is no screening happening in the healthcare system, a lot of patients do then get diagnosed with advanced stage malignancies and thus miss that opportunity for cure, which has been a big push that now we're emerging out of the pandemic. We want to make sure that all patients and advocates and family members are going back to care with their primary care physicians and restarting those discussions to make sure that if they are eligible for screening, that they go ahead and get those tests scheduled as soon as possible.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly and Exelexis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.